Okay. So from that, I would like to invite Dr. Ítala Silva. Dr. Ítala will talk to us about peptide-conjugated silver nanoparticles as anti-cancer agents. Ítala is there?
Yes.
Okay. So when you want.
Okay. Can you see my presentation?
Yeah.
Hi, everyone. Good afternoon. My name is Ítala Silva, and today I will talk about peptide-conjugated silver nanoparticles as anti-cancer agent. Breast cancer is the most common and lethal cancer in women worldwide. It is a very heterogeneous disease as evidenced by genetic and gene expression profiling studies. Breast cancer are classified based on the status of specific biomarkers that are further subclassified in different molecular subtypes. It is a very heterogeneous disease as evidenced by genetic, and breast cancer is the world's most prevalent cancer. According to estimates from the World Health Organization, familial breast cancer has suppressed lung cancer as the most commonly diagnosed cancer. One aggressive form of breast cancer is called triple negative because it lacks the expression of those three hormone receptors. They has a higher risk of both local and distant relapse that frequently present as visceral or brain metastases. A lack of alternative treatments and its aggressive nature make triple negative breast cancer a challenging disease. The use of nanotechnology is a promising approach to develop more specific and less toxic cancer therapies. Besides these, nanomaterials reveal big performances on both diagnosis and therapy of cancers. Their low biocompatibility limits their clinical application. Peptides can offer the versatility needed for a successful oncology drug discovery approach. Silver is one of the most popular noble metals used in nanoparticle synthesis. It has distinctive properties and can selectively target negatively charged cell membranes. As well known, cancer cells experience a high exposure of anionic phospholipids, such as phosphatidylserines, in the outer leaflet of their plasma membrane. Through electrostatic interactions between the cationic peptides and anionic phospholipids, AMPs can bind into the negatively charged cell membrane as well. Together, the unique interactions between peptide and nanoparticle surface provide an improved selectivity. Based on the preliminary data of the anti-cancer effect of antimicrobial peptides against cancer cells, together with the no anti-cancer therapeutic properties of silver nanoparticles, we expect that the nanostars help to specifically target the tumor and minimize the drug toxicity. We synthesize silver nanostars by the chemical reduction of the silver ions by neutral hydroxylamine, followed by a capping reduction step induced by the citrate. Briefly, silver nitrate was added dropwise to a mixture of hydroxylamine solution and sodium hydroxide solution. The sodium citrate were added to the mixture, and after 3 hours under stirring, the gray-colored suspension was centrifuged. This is the result of the synthesis. We use transmission electron microscopy to access the quality of the synthesis and the shape and size distribution of the nanostars particles. The images that we obtain show small star nanoparticles with few differences in morphology and size. The size distribution and concentration were determined by 3 different techniques: transmission electron microscopy, nanotracking analysis, and dynamic light scattering. Overall, the nanostars show a consistent size distribution throughout all the techniques that we used. The nanostars particles present an average size around the 100 nanometers. Zeta potential measurements are a powerful tool to obtain an approximated value of the surface charge of a particle in suspension. The nanostar shows a zeta potential of -41 millivolts indicating good dispersion and stability. Our results from UVVs show the characteristic absorption spectra of the synthesized silver nanostars that is expected, with a peak near the 400 nanometers and a broad spectrum. After the nanostar synthesis, we functionalize them with the AMPs through electrostatic interactions. We use different positively charged peptides that I will call AMP 1.9 and AMP 1B5 and their respective scramble negative controls. The scramble peptide have the same amino acids composition, but the sequence is scrambled. We use UVVs to access the conjugate stability. Both peptides show a broader peak and a decrease in absorbance as a result of the peptide binding to the nanostars. The best concentrations for the AMP 1.9 conjugates was 60 micromolar, and for the peptide AMP conjugates, the concentration was 20 micromolar. To access the peptide binding, DLS measurements were carried out to determine the changes in the nanostar size. For the AMP 1.9 and AMP 1B5 conjugates, we can observe a small increase in the hydrodynamic diameter size. For the both scramble conjugates, we can see that we have a bigger increase in the nanostar size that could induce the formation of aggregates. Our results from zeta potential show that nanostars have a negative charge, but when conjugated with the peptides, we can see a charge alteration to positive values. These results show that both peptides are binding to the nanostars and form a stable complex, but the scramble conjugates were binding as well and show less stability when compared with their respective peptides. To determine the biological effect of the conjugates, we did a viability assay to access the cytotoxic effects on cancer and healthy cells. Several established breast cancer cell lines are representative of the different tumor subtypes. Here, we use two different breast cancer cell lines, including a triple negative, and we also use a non-malignant breast epithelial cell lines to test the conjugate's cytotoxicity. The peptide AMP 1.9 and the scramble has no cytotoxic effect on MCF7 cells. Both conjugates show inhibition effect after 24 and 48 hours of incubation. The nanoparticles alone have inhibitory effect and show a time-dependent activity. When comparing the IC50, both conjugates present similar activity for this cell line. The peptide AMP 1.9 in their scramble shows no toxicity against triple negative breast cancer cells. Both conjugates show inhibition effect with very low concentrations and after 24 and 48 hours of incubation. The nanoparticles alone also have inhibitory effect for the triple negative breast cancer cells. And when we compare the IC50, both conjugates present similar activity as well. Looking for the cell viability of healthy cells, all peptides, conjugates, and nanostars show no toxicity to healthy cells. We also use human erythrocytes to calculate the percentage of hemolysis. With 24 hours of incubation, the peptide AMP 1.9 and their conjugate show the same hemolytic effect for concentrations above 12 micromolar. But for the conjugates, neither concentrations tested was able to induce 100% hemolysis when compared with the peptide alone. The scramble peptide showed no hemolytic effect in any concentrations tested, and the scramble conjugates has hemolytic effect only for concentrations above 50 micromolar. The nanostars has hemolytic effect for very small concentrations. Taking together all the results for the peptide AMP 1.9, the most effective conjugate is the silver nanostar scrambled conjugate, being most effective against triple-negative breast cancer cells and less toxic to healthy cells. Now the results for the AMP1B5 peptide. The AMP1B5 peptide show a cytotoxicity to MCF7 cells. And as expected, their scrambled peptide show no activity on these cells. Both conjugates show inhibition after 24 hours and 48 hours of incubation. When comparing the IC50, both conjugates have more inhibitory activity than the peptide alone. The peptide AMP1B5 shows cytotoxicity against triple-negative cells, and as expected, the scramble show no activity on these cells. Both conjugates show inhibition effect after 24 hours and 48 hours of incubation. And when comparing the IC50, both conjugates show more cytotoxic effect against triple-negative breast cancer cells than the peptide alone. The peptide AMP1B5 and the conjugate with the peptide 1B5 show toxicity to healthy cancer cells, to healthy cells, but the peptide alone is toxic with very low concentrations in comparison with the conjugates. These results demonstrate that the peptide conjugate to the silver nanostars can reduce the peptide toxicity. The scrambled peptide and their conjugates show no toxicity to healthy cells. The ability to cause hemolysis was also evaluated. The peptide AMP1B5 and the conjugated show a fast hemolytic effect. The scrambled peptide show no hemolysis in any concentrations tested, and the scrambled conjugates only presents risk of hemolysis for concentrations above 50 micromolar. For the AMP1B5, the conjugation with the silver nanostars did not improve the peptide toxicity against red blood cells. Taking together all the results for the peptide AMP1B5, the most effective conjugate is the silver nanostar scrambled conjugates, being most effective against cancer cells and less toxic to healthy cells. The induction of cytotoxicity can be confirmed by performing calceinetidine staining to access apoptosis. Apoptosis is a major process that maintains homeostasis of tissues and is considered as an ideal way for stop cancer cell proliferation. This assay is based on the simultaneous determination of live and dead cells. With this assay, you can confirm that the conjugate with AMP1.9 peptide and the AMP1.9 scrambled peptides can induce apoptosis in cancer cells, especially the triple-negative cells. And they have this effect, they induce apoptosis without cause death in healthy cells. For the AMP1B5, we see the same results. Here, the AMP1B5 conjugate and the AMP1B5 scrambled conjugate has cytotoxic effect against triple-negative cancer cells and MCF7 cells. With low concentrations, they can kill the cancer cells without being toxic to healthy cells. In conclusion, the silver nanostars conjugates tested are lethal to triple-negative breast cancer cells. From all peptides tested, the scrambled AMP1.9 showed better results. Until now, we showed that the peptide conjugation with the silver nanostars can minimize off-target toxicity and improve peptide anti-cancer activity by inducing apoptosis in cancer cells. I would like to thank my supervisor, Dr. Sonia Gonçalves, and the Professor Nuno Santos, Professor Eulália Pereira, and Professor Otávio Franco. I also want to thank the people that are involved in this work, and thank you all for listening.
Thank you, Ítala. I think we have time for one or two questions. Okay. Ítala, from the very beginning, what's the interaction between the peptides and the particles? How is the interaction? How do they?
Hi. Can you hear me?
Yeah, we can. I think Eneida now has some connection problem.
I hear the first part that
I think she's back now. She's
okay.
back now.
Can you hear me now?
Yes.
Okay, sorry. I was asking what is the interaction between the peptide and the nanoparticle?
The basic interaction is through electrostatic interactions, because the peptide has a positive charge and our nanoparticle has a negative charge. And we are now investigating the interactions between the conjugates and the cell membranes, the cancer cell membranes and health cell membranes through, with zeta potential measurements to see what kind of interactions we have, if we have electrostatic interactions or hydrophobic interactions, and it's the next part of the work.
And I didn't remember, the zeta potential of your particles are positive or negative?
Negative.
Negative. Okay,
yeah.
the overall, okay. Okay, do we have more questions?
Okay. Yes, I do have a question. Can I?
Yes.
Do we have time?
Yes.
Just a quick question. I'd like to know, Ítala, do you have any information by any data on in vivo assays, like how about the bioavailability of these nanoparticles, if they have any kind of effect in vivo or?
Yes, for nanostars, not yet, but we have a few studies with silver the spherical nanoparticles. The bioavailability of these nanoparticles is not very good because small, the size is very important, because the small nanoparticles, they can be very toxic. And bigger nanoparticles can be not so much toxic, but they are degraded very fast by the immune cells and the renal system. So for cancer cells, we saw that the bioavailability of the nanoparticles in the tumor sites is better, is higher, because of the morphology of the tumor, because they allows more infiltrations of because the vast vasculature. So this data is very case in this case of the nanoparticles.
Okay, thank you.